Okay. Hi, everybody. We're opening this a little bit early. As you come in, you'll see that there is a poll, and we'd like all of you to fill out the poll, and in a few minutes, we'll be starting the webinar. Yeah. So Nico, I'm going to give you your cue because we've got about 51 attendees who've already arrived. And if you want to start, it's over to you.
Thank you. Hello, everybody, and a very warm welcome to this IUSSP webinar. We're all very thrilled that you were able to join us today. I am Nico van Nimwegen. I'm the Secretary General of the International Union for the Scientific Study of Population, which, as you all know, is, of course, the worldwide network of population scientists. If you're not yet a member, this is the time to do so. And to join us, just go to our website, and there you will note that if you're a student, there are up to 4 years of free membership. So if you want to stay connected to the world community, join us today. And our website also informs us of all our activities, and including the upcoming webinar on demography and the data revolution of the 24th of November. But today's webinar is on the priorities in research on international migration and mobilities, and on the implications of the COVID pandemic and its legacies. We have a great set of speakers today. The webinar is moderated by Ellen Crayley of Colgate University, New York. Ellen is chair of the IUSSP Scientific Panel on International Migration. And her co-moderator is Mohammed Jalal Abbasi Jawazi from Tehran University, and a good colleague and member of the IUSSP Council. So we look forward to a great event, but first I'll pass the floor to Mary Ellen for some other information.
Okay.
Look forward.
Thank you, Nico. Just before we start this webinar, I wanted to give you some housekeeping information. For any questions and answers during the discussion period for this webinar, we ask you to use the Q&A and not the chat function. When using the Q&A, please scroll down and see what other questions are there. If you see a question you like, we'd really like you to uptick it. And if you'd like to modify it a bit, you can add something. And if there's no questions that you have your own question you want to ask that's different, please then post it. When asking questions, if it's to a specific panelist or person speaking, please type their name. And finally, if you'd like to ask your question or comment orally, we ask you to raise your hand. I'm not sure there'll be time at this webinar, but if there is, you might be called on. And we ask you to limit your speaking time, if you are called on, to 1 minute or less. Also, as you'll see, for those of you who just came in, there is a poll. We'd really like you to type your answers to that. It'll be shared later, and we'll keep it open until the end of the presentation. And now I'm turning this on over to Ellen Crayley. And thank you all very much. Ellen, over to you.
Thank you so much, Mary Ellen, and thank you to each of my colleagues on the screen. On behalf of the IUSSP Scientific Panel on International Migration, I thank you, I welcome you. We have nearly 300 people registered for this event from every corner of the world, which says a lot about the interest in the topic and the interest in the population sciences. I will just say that you inspire me, and I thank you. We are living in quite an era in which the population sciences are absolutely critical. We have key analytic and intellectual, methodological assets. We can provide perspective on the profound cohort and period effects of the pandemic in which we are living. We are hopeful that our panel and the activities that we have outlined and sought to implement over the year and the coming year will complement the needs, will really serve the needs of humanity, our globe, in addressing the issues of this pandemic and its legacies. Our activities focus on 3 different areas. One, we are looking very carefully at the data gaps, the need for information for serving our model building and our methods, our means of estimating international migration and mobilities going forward. And we're doing this in part by thinking about the advancements of a world migration survey. My colleagues Marcella Cerruti and Philippe Farks have been working on developing the case, and with my colleague Mariama Almombila from University of Ghana, thinking about the case for a world migration survey within the context of Africa. We've also been focusing on convening, on bringing together critical population scientists to address the challenges of this world, and in this case, the pandemic. And third, we're focused on training, really widening the human capital of population scientists and demographers in engaging international mobilities and migration. So we have an upcoming training workshop instructed by Guy Abel from Shanghai University in the new year. So more is that initiative. And in the spirit of each of these programs of activity for our panel, we bring together you today, and in particular, Professor Andrew Tatum and his team from WorldPop at the University of Southampton. And it's a pleasure to turn to Andy and his team, Alessandra Carioli, Jessica Floyd, Shanzi Lai, whose birthday it is today, Corinne Rutanjanachai, and Nick Rutanjanachai as well, who are giving a presentation on changes in international mobilities to mitigate the effects, the ongoing effects of the COVID-19 pandemic. Thank you very much, and I turn it over to Andrew.
Thank you. So just to note, we've recorded our presentation so we can answer questions throughout. I think that's going to be played now.
Yeah.
Great. Thanks for joining us. We're going to talk through some of the work we've been doing in the WorldPop group at the University of Southampton, looking at mapping and modeling COVID dynamics using mobility data, and to tell some of the story of the pandemic and how it has spread. In the WorldPop group, we're an applied research and implementation group, just to give you an idea where we're coming from, and our focus is on mapping population counts, characteristics, and mobility through integrating different geospatial data sets. So if we go on to the first slide, we're going to today talk about pandemics and human mobility, give you a bit of background, talk about how we measure human mobility, how the early stages of the spread of COVID within and beyond China took place, and then how we can use some of these mobile phone and mobility data sets for modeling the types of interventions that have been put in place, and how the connectivity across the world that we see nowadays has an impact on how we coordinate those interventions and the impact on COVID. And finally, we'll talk about what's next steps that we're undertaking and others are undertaking. So this is what we're living through. COVID-19 pandemic is nothing new. We've seen pandemics across human history, some far more severe, causing many more deaths than what we've seen. But there are a lot of similarities, but also a lot of differences. So if we go to the next slide, we've seen smallpox in thousands of years ago, spread from endemic area in India across the continent. You can see on the timelines there, it took many centuries to get there. The Black Death started in 1333 around in China, spread across the continent again, but this time you can see it took just a matter of decades to get across to Britain in 1349. Then we had 1918 influenza. It's spread around the world in a matter of months. So again, this acceleration of spread across the world. And then we're looking here at swine flu, starting in Mexico, spread across the world, in this case, in a matter of weeks. And of course, what we've seen with COVID is a spread to nearly every country in the world in, again, a matter of days and weeks. So why has this occurred? It's a question I get from my kids all the time, about 300 times a day. Why? So one component is human mobility. This is a study that a malariologist, David Bradley, did, asked his great-grandfather to map out his entire life history of travel. He lived in Kettering and didn't even make it to the neighboring town of Corby. Then he asked his grandfather, and his grandfather had access to train travel, was able to get from Kettering down to London. He then asked his father to map out his entire life travel history. This is the time of personal transport becoming a lot more affordable and available. And he made it down to Corsica and across Europe. And then himself, being a malariologist, had a lot of travel to Africa, but this is looking like probably many people, many of us on the webinar today, global travel, ease and cost of international travel reducing. And one of the reasons for that is air travel. So we see here the global air network in 1933. You couldn't really go very many places. And if you did, you had to stop over, in this case, about 10 times to go from London to Cape Town, with obviously a high chance of dying and crashing on each one of those routes. Nowadays, that air network is pretty extensive and massive and carrying huge volumes of people, though, of course, not right now. So how can we actually measure and map all of these changes in mobility? This huge amount of movement that's taking place in the air, land, and sea at the moment. So traditionally, we've had data sets like these that cover different components of the spatial scale and the temporal scale, from travel history surveys to cross-border and traffic surveys and census data asking people where they lived a year ago. And there's been many valuable studies in the past. We go to the next slide that shows things like movements in the Horn of Africa, all based on household and travel history surveys, asking people where they've been. And this is really valuable data for understanding these movements and getting into the demographics of them. But nowadays, we have a whole range of new sources of data that we can pull on. And what we're going to focus on today is two of those largest boxes: smartphone app location histories and anonymized mobile phone call detail records. You've seen a bit from the air and shipping statistics and personal GPS, but what we're really going to focus on, we go to the next slide, is this wealth of data that's coming now from mobile phones. And we're all leaving breadcrumbs. This is anonymized data, but if we go to the next slide and give an idea of what we're talking about, firstly with mobile phone call detail records. Here, I make a call at 9:48, it's routed through the nearest tower. If I move to a new location at 10:48, it's routed through a different tower. And so anonymously, I'm giving this kind of information. I'm moving from one broad region to another broad region. And if we aggregate across all the people, the millions of people who are using phones, and see in the next slide that we're getting a picture like this of the movement patterns of millions of people across Bangladesh over 3 months. Beautiful images, but also on the broad aggregate patterns of populations. And then also nowadays, a lot of us have smartphones and using apps on those. So just as you look at traffic statistics and see roads go red, that's caused by a measurement of the movement of smartphones anonymously in aggregate measures. And we've done a study not too long ago to look at the value of those kinds of data for movement patterns internationally and across countries. And we're all leaving these in aggregate and anonymized breadcrumbs of information about how we move around. So how can we use that kind of information? And these kinds of data are available now globally. They're of course biased and imperfect data sets, but in terms of changes in mobility and broad patterns, they're giving us insights that are rich, that we've never had before. So if I move on here to question of, on the next slide, how can we actually use these data for estimating disease movements and design control measures, starting with the situation in China. And I can hand over to my colleague Lai.
Thanks, Andy. Soon after the COVID-19 outbreak was reported in Wuhan, many people ask, how has COVID-19 virus spread within China and beyond China? And in our WOPO group, we conducted a preliminary report on this, and by using the mobile phone data. And here is a short video to show how people moved from Wuhan during the before the lockdown and after the lockdown in January. Yeah. Can you play this? Yeah. The yellow color, the yellow circle means the outflow from Wuhan, and the blue, it means the inflow of people coming to the Wuhan. And the size of the circle means the volume of the travelers. And we can find that the people movement before the Chinese New Year had the high volumes travel out of Wuhan, but after the Wuhan's lockdown, you can see now the people move out and move in Wuhan are becoming smaller, and it means that they have less people trapped between the cities in China, and try to contain the virus spread. And next slide, please. And this is this slide shows that we use the historical population movement data to show how the people movement in Wuhan and in other cities in the Hubei province. You can see that the people have the movement, the population movement has very significant seasonal patterns. And it means that before the Wuhan's lockdown already have a huge number of people have traveled from Wuhan to many other cities. And from the map, you can see the cities surrounding Wuhan have received more travelers infected with the virus from Wuhan. About other big cities like Beijing, Shanghai, and Guangzhou also receive many travelers. And next slide, please. And we also, in our analysis, we also look at the international risks of the travelers infected with this virus from Wuhan, from China. And here we use the airline travel data to explore how many people potentially traveled from the major 18 cities in China from into other countries. And it looks like most cities in South and East Asia receiving the travelers from China, but also many other cities in Europe and the North Americas have also high risk of the importation of this virus from China. And next one, please. Previous, which only shows the volume of the travelers. Here we try to use an epidemiological model to estimate how many travelers might be infected with this virus. And this both model called SEIR model. Using this model, we try to categorize the population into the subpopulation, such as the susceptible population, exposures to the virus, and also infectious travelers and populations, and also those people recovered from this disease. And in this model, we try to combine with the population movement data together to understand how the travelers move from the one city or one country to another city or another country. So this epidemiology model, we call the multi-patched model, can use to model the spread of the virus between areas, and also simulate the disease control measures such as the lockdown in different areas, and also account for the differences between areas, such as the population density, disease prevalence, and also the demography of the population. And here, the mobility data has played a very important role to help us to define the rate of the movement within or between the patches. Next one, please. And use this model, we estimate the early spread of the virus between the countries from the January to the April. And we can see the two peaks of the early intercontinental COVID-19 spread. The first peak is the travelers infected with this virus and exported from China. And the second and higher peak is the travelers infected with this virus in other continents, especially in Europe. Thank you. Next one. And here we can also use the model to look at the different interventions impact. The first one is the travel restriction. We can use the mobile phone data or air travel data to look at what's the decrease level of the travel between regions. And the second, we can use the data of the early detection and isolation of cases to explore the effect. And the third one, and we can identify the effect of the social distance, such as the contact reductions using the COVID-19 intervention. So we use the data in China derived from the mobile phone data and also the disease surveillance data, and to compare the three types of the interventions. And here, this figure shows the three types of the interventions effects. And we can find the case early detection isolation. The green curve shows if we don't have the early case detection or isolation, and the outbreak will be increased and very quickly and have more people affected. But also the social distancing and the inner city contact reduction derived from the mobile phone data can show, it shows they have also very important effect. And the lockdown of the cities, and because this is the situation in China, it sounds the lockdown in China for Wuhan is a little bit late and didn't have a very significant impact on to contain the virus spread. But all the combined intervention altogether have highest impact to try to spread this virus. Okay, I would like to hand over to Lori now.
Thanks, Lai. Yeah, so Lai has spoken a little bit about modeling successful MPI implementation within China. One of the other things that we were interested in was looking at MPI implementation strategies elsewhere throughout the globe. So we were interested in Europe initially due to just data availability, but we are hoping to expand these analyses elsewhere. But for our paper, we modeled regional lockdown strategies within Europe, specifically looking at costs and benefits of international coordination throughout the EU. So to do this, we used the epidemiological model that Lai mentioned, the SEIR model, Susceptible, Exposed, Infected, Recover, to explore different hypothetical scenarios across Europe in the context of lockdowns. So we wanted to look at lockdowns, beginning lockdowns, as well as ending lockdowns. So we first looked at synchronized cycles of beginning lockdowns versus asynchronous cycles. So what this means is what happens if countries implement lockdowns at the same time versus different times. But we also wanted to look at what is the effect of lifting lockdowns together versus uncoordinated. So what happens if one country lifts their lockdown before others? So to do this, to model these scenarios, we used a few different ingredients within our model. We had information on cases throughout Europe. We had mobility data from pre-COVID up through the first wave and the first lockdown through March in Europe. Using those two different components, we can get an idea of transmission of COVID throughout Europe. And then we can also look at how effective lockdowns were throughout European countries. So using the mobility data, these are data that Andy mentioned that we can collect from smartphones. So we used mobile phone operator Vodafone, which is very common throughout Europe, as well as Google data. And you can see a very drastic reduction, particularly in March, of mobility as we go throughout March and April of 2020. And on the right, we can see the same sort of drastic reduction, but what you see is that some countries had more of a reduction than others. So for example, in Germany, you can see that there was a much stronger reduction in movement than in Spain, France, and Italy, for example. So what you can already see is the emergence of different policies and different rates of mobility at the country level. So looking at synchronization of starting these different lockdowns, we did find that the more that countries coordinate in beginning their lockdowns, the better off the transmission would be. So the quicker it would go down to zero local transmission. We found throughout 90% of our simulations, local transmission was reduced down to zero if those lockdowns were synchronized together, versus only 5% of simulations went down to local transmission of zero if they were unsynchronized. So what this means is countries would phase their lockdowns on and off for a 3-week period, and they would do that all together. That's what sort of synchronous means. So if they did that, then it was very effective at getting transmission down to zero. We equally found that ending lockdown in a coordinated way was better than an uncoordinated way. So we found if one country ended their lockdown early, a pandemic resurgence across the continent could occur up to 5 weeks earlier than if they were coordinated. So 5 weeks in COVID time can be really valuable for expanding your testing and tracing apps, for example, for developing treatments and vaccines. So 5 weeks can really make quite a big difference. But one thing to note is that we did find significant variability in which countries mattered in terms of lifting their lockdowns early. So we found specifically that France and Germany were sort of the most important. If they lifted their lockdowns earlier, then you'd have a resurgence a lot sooner than other countries. And we found that that was because they tend to be very well connected. So with France, for example, you've got a very big international airport hub in Paris, and that can be, there's a lot of international travel to other places, versus Germany tends to be interconnected with neighboring countries, but it's more through rail networks. So it really matters which countries are coordinating together. So all of that is to say, we had that the first wave in our first sort of set of lockdowns. That is what this GIF is showing. So this is actual mobility observed from March throughout July of this year. So I'll let it cycle through again so that you can see it. But what this is showing is that we're starting to return, there was a return to normality in summer. So here is the beginning of February of 2020. So we start moving into March. This is when lockdowns start happening. You can see a drastic reduction in mobility across Europe that stays throughout April and into May, and starts beginning to increase again in late spring, early summer, so that you're starting to see, things are beginning to return to normal. And that's also what we see here. We see a very strong reduction of mobility throughout April, but that sort of creeps up throughout summer. And unfortunately, that has sort of resulted in a second wave that we are currently in. But that being said, our predictions sort of turned into reality because our message is important now more than ever, that until we can begin coordinating at the regional level between countries and also within countries, then we're going to continue playing a European whack-a-mole, which is an American game, American festival game where different moles sort of pop up and you're always like using a hammer to hit them down. But whenever one goes down, another comes up. So that's sort of the situation that we will continue to find ourselves in unless we can begin coordinating and synchronizing our lockdowns and our MPIs as much as possible. But that being said, you know, I realize that coordination across all countries throughout the European Union can be really infeasible, but there's still potential for highly connected subcommunities within Europe. And that's what this figure here is showing, that perhaps you might have countries like Spain, France, and parts of the UK coordinating versus parts of Eastern Europe and things like that. But basically the message is the more coordinated, the better. So now I will hand off to Alessandra to discuss what is next.
Thank you, Corey. Our COVID-19 analysis have highlighted how population movements have facilitated the spread of the virus domestically and internationally, and how the non-pharmaceutical interventions have substantially mitigated the first wave of COVID-19 across the world. Mobility has proven to be key in assessing the pace of spread of the disease and also containment measures, as well as likelihoods of future waves of COVID-19 and their impacts on many sectors of societies. And since mobility is not spread out homogeneously throughout the year, we want to give special attention to seasonal mobility, especially now that we are approaching Thanksgiving in the US and the Christmas season across many countries. It is very important that we understand how to address travel and implement restriction effectively. The number of infection and severe cases also varies by age group, and not only due to mobility, but also to country-specific profiles. So we can see that in Western countries, they have high proportions of over 65-year-olds population. For some countries is around 20–23%. However, that is not the case for low and middle income countries where those proportions are much lower. For instance, in the Indian subcontinent, in India, the proportion of over 65 is around 6%. So there are different age profiles affected by COVID-19, and for instance in India is between 40 and 60 years old. To address this, we have assembled subnational data sets with population age and sex structures, which are available to our portal, and the results of this data set are shown in the slide with the age and sex structure. Of course, there are other challenges that will arise with COVID-19, not only in terms of its transmission, but its effect and impact on health for countries. We have already seen that in Western countries, for instance, patients with vascular diseases are not being provided for as before. And in low and middle income countries, that is especially true, for instance, for maternal and newborn health, that may be not catered as before. For food security, vaccination campaigns are likely to be affected. And we also have assembled various data sets containing maternal and newborn health information, travel time, and also vaccination for fine grid scale data. And now I will leave my floor to Andy for last remarks.
Thank you. Yes, so just to summarize, hopefully we've shown you all that disease outbreaks are becoming pandemics more rapidly and often than ever before. And an important component of that is the volume of human mobility. It's increased substantially and is causing problems in terms of the speed with which diseases that are emerging in one area of the world can quickly now appear in the other side of the world. On the other side of things, we do have new forms of data from mobile phones, from a range of other sources that are aiding our abilities to map, model, and respond to outbreaks. They're not perfect data sets, but they are giving us a richness of information that we've never had before and can be fed into the types of models that we see and hear about every day in the press, and is responsible for a lot of the interventions that we're living through. Importantly, integrating those data with other forms of data that we can validate. So from household surveys, from census data are vital if we're going to make use of these data in a proper way and account for biases. So the value of geography and demographics in understanding and using these data sets is important. And we'll finish here just so if you can get some further information on the kind of analysis and data we presented today, and you can download many of the data sets we presented in terms of the spatial demographics data. But thank you very much for listening, and we will happily take questions. Thank you.
Thank you so much, Andrew, and your team, each one. What a wonderful, provocative, important presentation. And I'm really struck. We talk a lot about collaborative research, and of course, WorldPop is really modeling that across disciplines. But what I find so exciting in terms of the population scientists is that now we have migration scholars working with health scholars, people who study mortality and morbidity. We have women's health issues and the structure by age and gender and reproductive health kind of being integrated into your work. So I think one of the legacies of the pandemic is more collaborative work among demographers and population scientists. I think it's so exciting. And really moving our models forward. We should come out of this with no longer working in our silos in terms of disciplines, but also within the population scientists. Fertility, mortality, migration have to be integrated in our analyses. There were several questions. We wanted to have a few questions now before we go into our commentary to get people talking. And there were questions about data, your very rich data. Jabir asked about biases within the data, and you responded in, Andy, in the Q&A. Wonder if you could talk about, if you could add a few more characteristics to your data set, what would those be? Could you talk about not just biases, but how you might, what you might want resolved in your data?
Sure, I mean, these are valuable data sets, but I'm sure as demographers, we all know that they are biased. We don't all carry mobile phones. We don't all use them all the time. And sometimes it's a whole family carrying one phone. Sometimes the poorest cannot afford a smartphone. So there are major challenges in using these data sets that we need to account for and understand. And what we'd ideally like is for more validation, so more of these traditional data sources, household surveys that can tell us information about who is using a phone and how it's being used. Phone surveys, household surveys, census data that are asking questions about phone ownership and usage. All of that will help anchor and help us understand the uncertainties and biases in these data sets.
Thank you. Monica Akuwibi has a question. Monica, would you like to ask your question? If you unmute yourself, please, that would be wonderful. There we go. Monica? Please speak, yes. Monica, can we hear you? Perhaps type in your question in the Q&A or speak. Okay, while we're waiting for Monica, I had one other question, if you don't mind. You know, we do migration here, and Andrew and your colleagues, maybe one of your colleagues would like to take this on. Is there any way to constrain the data to think about length of stay and length of trip as we kind of think about mobility versus migration? Is that a piece of information that we could estimate or model or gather more information on?
Oh, maybe Nick, Corey,
Sure.
can work on this.
Yeah, it depends on the data sets. So, with the mobile phone data sets that we have, essentially the way those work is we have timestamps, we have when the cell phone makes connections with towers, and we have what towers they made connections with at different times. So, in various data sets, we have looked at, we can assign residence location based on where people spend their time overnight. We can then see where they go over multiple nights, how long they stay. For this coronavirus work, we didn't incorporate that, but so I usually work with malaria. And with malaria, a lot of the mosquito vectors are more active at night. So in that case, we care about nights. And in those sorts of studies, we've done things like look specifically at when people spend at least one night away from home, that kind of thing. And then weight their risk in terms of how many nights they spent away. So certainly there are, especially in the mobile phone data sets, ways to address that kind of thing.
That's terrific. That's very, very valuable. Well, thank you very much. I would like now to turn to layering in some perspective on your presentation and on migration and mobility research within this area. So I'm going to turn to our good colleague, Ayman Zauri, who is president and founder of the Egyptian Society for Migration Studies and former chair of an international IUSSP panel on international migration. So Ayman, may I turn to you?
Ayman, we need you to unmute your microphone.
Okay, so let me start from the beginning. It's very important to thank Ellen for her invitation to join this webinar. I'm going to talk about the priorities in demographic theory and modeling of international migration and mobilities, actually. But before starting, I would like to give a quick comment on the presentation. The presentation actually of the team is inspiring, especially that they use a lot of data sets and they summarize it in a very attractive, very visual way. So let me now move to my short presentation, short comment on the topic in general. So I specified a set of topics to talk about as related to the overall theme of the webinar. So first I talk about why migration is important. We know that it's important, but I would like to shed some highlights on the why important from demographic point of view, and also migration and demography, the interrelationships between migration and demography. Third, I'm going to talk about conventional measures of migration, and I question whether they are enough or we need more to develop more measures on migration, and also to talk about the need for dynamic and innovative measures of migration. And then I end up talking about the way forward with special focus on the new and junior and the next generation demographers and population scientists. So if I talk about the first topic, which is migration is important, we all know that migration is, as a whole, for the whole overall population of the world, is negligible. It is 3.4% only of the overall population, but this quantification by percentages hides the fact that they are 272. This is the estimate of 2019. So now they are more than that, even with the COVID phase or the COVID pandemic. So we're talking about a large number of population, despite the fact that the percentage related to the population of the world is not that high. So, and also internal migration is about, in fact, is about triple the international migration. So if you're talking about the mobile people or those people who are mobile, you're talking about 1 billion out of the 7.8 billion of the population. Here, migration is important, and the importance also of migration that the migrants are not evenly distributed among the world map. So they follow specific routes, and they affect specific countries negatively or and positively, of course, mainly positively. So they also the political and economic and socio-cultural dimensions of migration are important. So from a political point of view, from the economic point of view, which is very important, which is crystallized in the remittances, and as well as the socio-cultural dimensions of migration. So migration is very important for the human being, through which the people move, not only physically, but the thoughts move also, and philosophies, religions, and so on. In addition to the mobility of pandemics as well. So this is just to show the importance of migration. I move quickly because of the time constraints to migration and demography. Well, actually, migration and is one important factor in population dynamics, in addition to the other two important factors also, which are births and deaths. But the fact that, I believe that not because I'm a demographer working in migration field, but because migration actually is more important, or as important as both births and deaths combined, simply because when someone moves from one place to the other, he or she actually did a sort of the two things. He dies in he gives the effect of dying when he leave his country of origin, and he gives the effect of being born again in another country. So, and also because it involves two places, the place of origin and place of destination, rather than deaths and births where they occur in one place. So, and because of that, so that the analysis of migration rates, analysis of migration ratios entails the utilization of immigration and immigration, both in both sides. So the one movement of an individual person is regarded twice, and from a different perspective from the two sides of the points. Also, we demographers and population scientists, we laid the base, actually the basis of the migration theory early as in 1966 with the Everett Lee as very famous push and pull theory, which was actually the base of the new and the successive migration theories. Till we reach now, we use in literature and international reports the term drivers of migration. In fact, drivers of migration is part of this theory, the Everett Lee's theory. It is just the push factors, ignoring the pull factors and the intervening factors in the middle. So drivers of migration are also demographic. So I move to the third issue. Which is conventional measures of migration, and I question whether they are enough or not. And the question is not, of course. So, all of us as population scientists and demographers who know the crude migration rates and refined or specific migration rates, such as crude immigration, immigration rates, net immigration, net immigration, and also the specific rates as related to specific segments of population, as age, as males and females, as racial distribution of the population. And we can develop even any demographers and population can develop any specific rates, or any various kind specific rates of migration. The fact that these measures are static. These measures are static rather than being dynamic. So they always capture migration in a specific point in time or in a specific period of time. this is one. Two, doesn't capture new types of human mobility. These measures don't capture new types of human mobility that prevail nowadays. So we do feel that there is a need for dynamic and innovative measures of migration that can also capture the regular migration, measures of regular migration, instead of just reporting those who arrived to a specific destination in receiving countries. We need to develop demographic measures for this. Also, the mixed migration, I know that the term is not preferred for some countries, but we need also to define and reshape the term of mixed migration and develop measures to just present the mixed migration not only to in academic work, but also in the arena of policies related to migration. Also, we need to develop measures for circular migration, which is now prevailing more than ever, seasonal migration as well, and the most important one for nowadays is measures of crisis-related migration, such as the COVID-19 and its related unrelated crisis issues. So actually, I end up to the last point that I would like to talk about, which is the way forward. What can be done? There is a need for migration data, whether structured migration data, the conventional ones, or the ones that were presented in the main presentation in this webinar. So the big data and the new and innovative data sets. Second, the need for new techniques in the analysis of migration data. So the conventional measures of migration that we always use in demography are not enough to capture new phenomena on migration and new types of mobility, and also the speed way of population mobility nowadays. So we cannot wait. I mean that we, of course, we wait for 1 year to calculate the annual rate, but we need other intermediate ways of calculating human mobility, in addition to the rigid measures of migration. So accommodation of new terms also related to new types of human mobility is very important, as I mentioned, such as the mixed migration and other related terms. The last thing, which is very important, which is part of the IUSSP mission and mandate also, which is training of new demographers, training of the new generation demographers and population scientists in order to, to follow up and to do their work and to be involved in the data collection on relation to migration and also the analysis of data. Thank you very much.
Thank you, Ayman. Thank you for such a comprehensive, such a rich presentation. We so appreciate it. You've really set the stage. And we're going to now turn to Mari McAuliffe and her presentation. Mari's very interested in the conditions under which the new generation of migration and population scholars will be working because of COVID, hence our polling questions. I haven't looked at these data. Mary Ellen has just posted them. And we find, an interesting split in terms of collaborative research within this emerging era of COVID. We find, again, some increase in working with researchers from other countries. I certainly would have checked that box. There has been alteration in the research focus with some difference, so people are gaining momentum in some new ways. And, I work at Colgate, we read a lot here. So we asked about whether there have been new, kind of connections to the research literature. So yes, changes. And now I turn to our good colleague, Mari McAuliffe, who is the head of the Migration Research Division at IOM, to think about these patterns in relationship to where we need those data, where we need these analyses. Mari?
Great, thank you very much indeed for that introduction, Ellen, and thanks also to IUSSP and to Ellen and others for the opportunity to make a very kind of brief commentary really in regards to this very important topic on priorities in research in international migration and mobilities. I must admit I was the one that suggested that polling question, and I think particularly relevant for researchers all around the world. I'm working in an operational agency where operations have to kind of cease, but for us as researchers, we're busier than ever, many of us. And we've also had this wonderful opportunity, which is an upside to a very dark sort of cloud. The silver lining is that we have been able to connect, and it's wonderful to see so many people from all over the world join us today for this webinar. So thank you again for the opportunity. I'll move through this very quickly and I'll slide over some of the things that others have already mentioned. First thing, I guess, to sort of situate this discussion and this particular kind of focus that we're talking about in an IUSSP context and the international migration kind of panel is we saw the first fantastic presentation from the World POP team really looking at the use of mobility data in an epidemiology sort of context. We also know, of course, that the very significant priority in COVID-19 research is in relation to physical health. It's in relation to immunology, biology, treatments and vaccines. And of course, we know the race is on. But there's also been a real surge in the priorities around mental health, of course, and psychology, because it's had quite profound impacts around the world. What we will be looking at kind of now and in this discussion is really looking at COVID-19 in regards to mobility, immobility, and the interlinkages with migration globally. Do a very brief recap. Look at some of the emerging priorities. It's a question that actually I get asked quite often. So here's something I prepared earlier, and also then some of the challenges and opportunities ahead, which do link to some of the questions that were put forward in the Q&A earlier. So just a very, very brief kind of recap. This is a bit of a how not to do PowerPoint, of course, because there's so much on your screen now. But really on the left-hand side, it's a point that Andy raised earlier. We have seen bottom left-hand corner, we've seen the number of air passengers carried really increase in the last few decades. And that is one of the reasons why, if you look at the top left-hand side, we've seen the travel restrictions really very much in an unprecedented sort of fashion, because we haven't had the degree of air mobility and air transportation at the same sort of scale previously for other pandemics. So we have seen a very strong focus, especially peaking in mid-April. That graph finishes in mid-September, but of course we know, as many of us have gone into lockdown again, that we're also seeing both internal and international travel restrictions being reimposed as the second wave kind of surges in different parts of the world. On the kind of the right-hand side there, I've put in pre-COVID data, just a graph that we refer to show us how important it is to link the impacts of COVID-19 to underlying demographic issues. For example, this one is in relation to the very kind of highly gendered domestic workers kind of regimes and where they are located geographically all around the world. So we do know, for example, that domestic workers do tend to be women in high-income countries, and they will be much more likely to be affected in the context of a global pandemic with such high infection and transmission rates. But also there are other migrants on the front line, healthcare workers, as we know, aged care and childcare workers, etc., transportation, and of course seasonal agricultural workers, both internal migrants as well as international migrants. Here is a bit of a depiction in terms of how the immobility restrictions are impacting on international migration and causing major disruptions. Now, of course, this is very simplified. It's a kind of an infographic put together to look at the different impacts on migrants as well as other travellers in different parts of the migration cycle. So departure from origin, entry, of course, return and stay, most especially, is where we're having quite significant impacts, with vulnerabilities being intensified for people, for example, who are in displaced person camps, both IDPs and refugees, as well as irregular migrants and other migrant workers who might be in poor housing, or they could be detainees in immigration detention, for example. I've put this one in terms of international remittances because what we are seeing is we're seeing things shift very rapidly. So initially the World Bank had forecast that there would be a 20% decline in international remittances in 2020. Only last week, actually, they revised that to 14%. And looking at some of the aspects, you can see bottom right-hand corner there is a bit of a graph for some of the key origin countries or recipient countries of international remittances produced by the IMF. And what that does show is we did see a real bottom out in kind of like April, May, but then in July and moving into August, we have seen some real peaks, and some of them have been record peaks of international remittance flows. Now, there are some interesting dynamics there, but that is certainly an area for research into behavioural issues, but also shifts from informal remittance channels, such as taking suitcases with money in them as you travel back to visit family, for example, into more formal channels because of the immobility restrictions. So the top kind of 3 COVID-19 migration research priorities for the next sort of 2 to 5 years, I've really packaged them up into kind of 3 key areas: the mobility restriction impacts, which will be felt for a long time, as well as the more kind of immediate acute kind of health crisis response and in relation to having stranded migrants all around the world. We do need to be looking at new mobility regimes that are likely to emerge, and we'll be tracking that fairly closely, and the potential for intensifying inequality in regards to mobility. Protections and vulnerabilities are particularly important in terms of migrants and how they are situated in broader populations. We know, for example, that many people have been stranded without social protection, without access to healthcare, without access to income kind of regimes and alleviation, and they may have actually even lost their shelter, lost the right to live in a particular place. So those kind of impacts are going to be immediate, but they're also going to be long-term. We also need to be looking at international remittances, follow the money, as they say. There's a whole range of different aspects in terms of behavioural impacts, changes from informal to formal, and also to get a better handle on internal remittances, which of course have been disrupted. On the right-hand side, I've put in some of the cross-cutting issues, and underpinning a lot of these are the human rights of migrants right the way throughout the entire migration cycle. We'll also need to be looking very closely in terms of migrants' contributions to socioeconomic recovery, and of course that is particularly interlinked to both mobility protections and also into international remittances. And as I mentioned earlier, global inequality is going to be a very, very key focus as we recover from COVID-19. Now, the second to last slide, I do want to mention one initiative in a second, but this is in regards to challenges and opportunities. And quite a few people did mention in regards to the earlier presentations, some of the ethical issues, some of potentially the privacy issues. We also know that there are data set methodological limitations. So that's in the challenges kind of column, if you like. But there are the opportunities to reconceptualize migration and mobility in the context of more data than ever before, as Andy mentioned, but also some of the methodological innovations. But it has to be balanced against the limitations and how far you can really utilize the data in terms of informing policy and operational responses and where that line is. We also have to acknowledge that fieldwork is going to be impacted, and how we actually look at some of those kind of changes in terms of a lack of being able to actually do fieldwork and what kind of methods we can actually incorporate. But also we'd like to highlight too in terms of the inclusive collaboration. So bridging the geographic and the disciplinary divides through tech, utilising virtual platforms for learning, such as, say, for example, Gaia Bell's workshop early next year. And also really looking at how we can make sure that we're sort of keeping a focus on what I would call the migration basics. we are seeing very significant changes, as Eamon mentioned, in regards to migration and mobility. But we do need to be very careful about how we conceptualize, how we discuss, how we present data, how we present research findings across the spectrum, in terms of not further blurring the line between migration and mobility, especially because some of the consequences can be quite significant with the xenophobic, racist sort of targeting of migrants in different settings around the world. I will just highlight a paper by Ron Skeldon, a 2018 paper, if people are interested in the issue around conceptualization of migration and mobilities, a fantastic paper that he put out in 2018, which goes straight to the heart of this topic and is a very good resource. And lastly, just mentioning the UN research roadmap that some people may not know about in regards to COVID-19 recovery. There's a lot of information, of course, on their website, but there are 5 pillars. And if you look across those pillars, the issues of mobility, migration, and migrants hits all of those very significantly and will be a focus in the research roadmap as they go forward. Thank you.
Ellen, you're on mute.
Thank you so much, Mari. You've done a tour de force in working across different domains. Your outline of cross-cutting themes in relationship to research priorities certainly complements Eamon's presentation, and I know is going to complement Jalal's in a few minutes. But you also given us some ideas among the 300 participants of how to collaborate and how to share our expertise in order to address those cross-cutting themes. I think that's very exciting. We have a number of questions that have been coming in. I'm going to start with Monica's, who tried to pose a question before, and this goes to Andy and his team about the levels or the significance of impacts of COVID on Southern African countries, and whether you have, particularly those of you who have backgrounds in epidemiology, believe there are particular social and economic vulnerabilities or risk factors within certain populations that might amplify the effects of COVID. And thinking about the regional differences in terms of the impacts on mobility within the context of risk factors.
That's a good question. I'm not sure we can have a full answer on that. I mean, certainly there are demographic differences in what Alessandra presented, and the data we've assembled are differences between some of the Southern African countries versus the rest. I don't know. Also, Nick, Jess have been working on mobility data in that region for malaria elimination purposes and may have extra things to say.
Yeah, I think there's an interesting double-edged sword in terms of mobility in a lot of, at least the countries that we've looked at, for example, Mozambique, in that in particular the coronavirus, I think there was actually a protective effect in terms of how workplaces manifest in a lot of sub-Saharan African countries. So in a lot of where a lot of industry isn't necessarily office-based, indoor with recirculated air, things like that, I think that actually prevented some of the COVID-19 transmission that we see in the global north. But on the other end of it, I think what that also means is that mobility was harder to change because, in response to growing cases, people still need to, in a lot of cases, people still need to do the travel that they need to do for various resources. And so in some way, it cuts both ways. It makes, on one hand, I think it's more robust to the potential introduction of COVID-19, and that's one reason why we haven't seen huge outbreaks in countries other than like South Africa and Ethiopia, Egypt, I think. But then on the other hand, there's potentially less, it's harder to socially distance in a lot of cities and in a lot of regions, I'd say.
Thank you so much. We have several questions concerning policy, migration policy. And I think this goes to everyone who's spoken so far, and certainly Jalal, if you want to jump in kind of early. But Mari, Mohammed, Adadi, Diego, Aitaraldi, Michaela, Sadavik are all very interested in the policy implications of the research. And I know, Michaela, you were asking the World Pop team about sharing the results with, and what was that dynamic with policymakers. And then Mari, so we'll kind of start there. And then Mari, if you could be thinking about the implications for migration policy going forward, and how to, what can you envision in terms of migration policy post-COVID or in the legacies of COVID? And also how to identify migration research priorities to policy makers. That was Diego's particular question. So I've tried to stack those. Let's start with Andy and your team. If you could talk about your kind of communication of your research results and that dynamic.
Yeah, I can start and then pass on to others, but one of the closest engagements we have is in the UK with the Office for National Statistics, using these kinds of smartphone-based mobility data, particularly in the UK where there has been a policy of local restrictions. And so understanding how those are connected to other regions, where are their hotspots of movement, and how you might tailor those different strategies based on what you're seeing in the patterns of response and the typical patterns of movement. How is that changing from normal? Maybe also I can hand over to Lai, who's very engaged in China.
Yeah, I was an epidemiologist in China CDC before I moved to UK. So for me, actually, it's quite, I have very good connection with my old colleagues. So when the outbreak happened in Wuhan, and they contacted me to help them to do some analysis and support them to support them. So, and I also graduated from a medical school in Wuhan. So you know that how many friends they are live in Wuhan in China. And for this outbreak, we use the mobile phone data to look at how the population movement and what kinds of intervention that impacts the outbreak control. And when we have some evidence, and I just directly contact them and share with them, and such as we just like 1 or 2 weeks after the lockdown in Wuhan, and they didn't have any, they still can see a very clear decrease of the cases, and they are very worried how effective of these kinds of measures. So we do some modeling work, and we said, yes, maybe you can see because of the incubation period, and also need to take some time of the to wait to look at the pattern. So, but we clearly tell them based on our modeling work, and we said the outbreak will be going down and in the middle of the February, and it's quite safe to lifting the lockdown in China in late March, and even in Wuhan it's very safe to lifting the lockdown in early April. And now the situation is quite similar. And yeah, that's one kind of the evidence we support the policy. And also for Africa, we share the information about the early spread risk from China to Africa. And we said it sounds very low risk of some of the Chinese travelers contain this virus, and they travel to Africa. And yeah, some of the situation is quite match with the actual situation. So thank you.
Thank you very much. Mari, would you like to talk about the future of policy?
Sure, thanks, Ellen, and thank you very much to both Mohammed and Diego for those questions. I'll answer Mohammed's first. So really in regards to the impact of COVID-19 on migration policy in the future, it does depend on the underlying migration dynamics, demographics, of course, and also the policy settings of a particular government. Now, most migration policies are set at the national level, some are set at the subnational level, and there's of course the overarching international law framework that, you know, treaties, conventions, as well as negotiated texts that are non-binding, such as the Global Compact on safe, orderly, regular migration, for example. But we know that most migration policies actually are set at the national level. It will depend on what was pre-COVID mobility and migration regimes in a particular context prior to COVID. So, for example, we've known for a long time that, you know, North Asia is suffering a demographic sort of crisis. We've seen recently some new data that has emerged in regards to Japan, and that they have seen a real slump in regards to marriages, which they're forecasting will have a really serious impact on births, because most births are in wedlock. So they already know that they're going to have an even more intensified demographic crunch. So that's going to force them to look again, reassess their immigration policy settings. I'm not sure whether that will change, because there are so many different variables in regards to migration policy, as you know, but in those different contexts, that's just one sort of short little example of how COVID-19 is going to have an impact on migration deliberations in regards to policy, not necessarily saying that they will change their policy settings. Now, in terms of Diego's question, which, you know, comes up quite a lot, I think it's been a shock for many policymakers, and it depends on how we define policymakers. If we're talking about politicians, that's one thing. If we're talking about parliamentarians, that's another thing. If we're talking about senior officials who are deeply involved in policy processes, then that's another thing entirely. But what we do know, even looking at those particular kind of subgroups of the broader kind of remit of policymakers, we do know that in many different parts of the world have been shocked, for example, at the essential workers in their societies during a crisis, many of whom are migrants, and some of whom are actually undocumented and don't have access to, you know, universal healthcare. They don't have access to social protection, and yet they are essential in our daily lives. And here we're talking about, you know, harvesters who are circular migrants, for example, or who are internal migrants within India, for example. We're talking about people who live in Thailand and work in agriculture, but they might be from Cambodia. So we've seen that that has been a bit of a shock for many people in different systems. I'm not entirely sure, of course, it'll depend again on the political context, in the policy context, the economic context going forward in regards to COVID-19 and the economic issues that we're facing globally. But there is a real opportunity, I think, to really make that point that there are very significant contributions that migrants make in a range of different settings that have been highlighted and elevated during COVID-19 as countries have grappled with, you know, this very significant global health crisis. So I'm kind of optimistic, but it does depend so much on the politics. And, you know, I promised myself I wouldn't mention the US election, but, you know, we just need to turn to the US at the moment and look at the politics of immigration policy. It's been, you know, there'll be a lot of PhDs being written on it now, probably as we speak, but it's been a very, very interesting time in regards to that particular issue.
Yeah. Thank you so much. There are more questions, but I do want to turn to my good colleague, Jalal Abbasi-Shahbazi. Jabir Belkira raises a question about travel restrictions and the relationship to irregular migration and uncontrolled movements. Mari kind of anticipated that, so did Aman. And I know you're going to be thinking about some of these issues of vulnerabilities as well as resilience, Jalal. So it's my great pleasure to turn to Professor Abbasi-Shahbazi from the University of Tehran, who will have kind of some concluding perspectives. I thank you all and turn to Jalal.
Thank you very much, Ellen, and good morning, good afternoon, and good night to all dear friends and colleagues across the globe. It's a great pleasure and honor to present a synthesis to the stimulating presentations that have just been made by our dear colleagues on an important topic on international migration, and particularly at this very crucial and important time. Let me briefly, if I can share, sorry. Okay. Before I present the synthesis, let's take you to the take-home messages. As we've heard, international migration has become one of the main policy challenges of our time. It has attracted the attention of demographers and other experts in related disciplines. We've been the collaboration between different disciplines. It needs to be reconceptualized and measured innovatively. Also it has significant implications for research, training, and policy during and post-COVID-19. We've heard by colleagues, by our colleagues, that international migration has been very important in demographic research. First, because international migration have increased substantially in a scale and complexity and diversity in recent decades. It presents major multinational, national, subnational, and community challenges. We've heard from Andy's team that the growing volume of human mobility is a key driver to the disease outbreak due to COVID-19, and the pandemic has caused challenges for international mobilities and also created opportunities for data collection, measurement, and policy interventions. We've noted that the nature of mobility and international migration has changed in recent decades, and particularly in recent years, and thus the traditional approaches to the study of international migration is no longer relevant, and we have to think and rethink about the definition and measurement of international migration. If we look at migration, there is a continuum. From the left-hand side, we have voluntary movement, and the right side is forced movement. And the further we go from the right to the left, or from the left to the right, we know little about forced migration. And interestingly, the new patterns of migration is also unknown to us, and we have to explore more from the new data that become available. Normally, when we want to address some questions on international migration, we have to first ask who is voluntary or forcibly moved, how and why, and what are the sources of information for migrants. What are the decision-making processes for migration, reasons for choosing the pathways, and also what is important is to analyze the social and demographic characteristics as well as adaptation patterns of migrants. What are the role of diaspora in the development of origin countries? And relevant to the topic of today's presentations is the implications of the pandemic on international migration and mobilities. And finally, as it was the case in several questions that were made, policies for support of migrants at the origin and destination places. As we noted, new forms of mobilities have occurred, and there are several reasons and many reasons for mobilities these days. And the context within which we've been living over the last, several decades have changed. And thus, we need to define migration in a new way. And then we need new frameworks for the explanation of international mobilities. There are methodological challenges with the international migration data that have been addressed actually before by scholars. What events are we talking about? What numbers are we taking? Which numbers to take, and when, for example, migration numbers change over time, and when is the best time to take the numbers that accurately reflects instance of movements. And usually we need data disaggregated by several characteristics to design policies, as Mari was alluding us to. And this team showed us that we used to use traditional data sources for measuring population and migration data. But now we have novel data and new data, including a smartphone, application histories, air and shipping statistics, personal GPS, etc., that helps us to as Eamon was saying, to measure new and innovative ways of what they call it, measures of migration, mixed migration, circular migration, and even daily, monthly, and weekly movements that are important for policy making. One issue that was not raised as such at the meeting was the situation of undocumented migrants and refugees that have been impacted or are being impacted by COVID-19, and the issue that they don't have any documentation, it hinders their access to services, economic situation that they are facing, and the rise of unemployment and job losses of job opportunities affects both low and middle class natives and migrants. And when there is a policy at the national levels, maybe natives are preferred instead of migrants. So the situation of disadvantaged and vulnerables, as was mentioned by Mari, is very important. These are the areas of research priorities that Mari mentioned: mobility restriction impacts on health and other aspects of people's life, protections of and social protection for different groups and vulnerables, and also international remittances that Mari was mentioning. And all these need to be studied with taking into account three different cross-cutting issues of human rights, migrants' contribution to socioeconomic recovery of both the destination and home countries, and finally, global inequalities. Let me end my presentation by this slide, that there is a need for reconceptualization of international migration and human mobility post COVID-19. There is a need for dynamic data and innovative techniques for measuring and modeling international immobility and mobility. We need to take multidisciplinary approach and comprehensive theories to both explain migration and also to deepen our understanding of international migration from different angles. As it was mentioned also by Eamon, we need to offer courses including new migration theories and methodologies for training of junior demographers. as it was the case today, we need to do applied research in response to the new policies and interventions due to the pandemic. We need to design policies based on the data that demographers and geographers and epidemiologists are working on. And finally, there is a need for national and international research collaborations and partnership on human mobilities. It was a difficult task to summarize what have been said, but I tried my best and hope this will provide an opportunity for our colleagues to think further and present their findings in the future. Thank you.
Thank you, Jalal. You did a wonderful job synthesizing the talks, the work of our colleagues, each of you who have presented today, and each of the members of our audience who have participated. We've really pushed each other to develop a new agenda of international mobility and migration research, revealing the policy implications, the importance of what we all do. I thank you each for that. I am so confident in the future of the population sciences. As I look to the World Pop team, we see the future ahead. We also are witnessing support for one another. And in this era of COVID, we need to do that. We need to support each other. And we're witnessing that at University of Southampton and in Egypt and at the IOM at the University of Tehran. So I thank you for your support. There is so much going on. And we need to support what's going on. Diego alerted us that the South African government is supporting a series of webinars on the impacts of COVID. You know, watch for that. We have the UN Statistical Commission taking on conceptual issues, definitional issues of international migration data and statistics. We have the Global Compact, we have the leadership of IOM. My colleagues at the Center for Migration Studies have a seminar coming up on November 10th on research priorities, really rich information that is communicated by people who do the hard lifting. So I want to conclude by thanking my colleagues, Nico, Mary Ellen, and Paul at the Secretariat for allowing this conversation to happen. I thank you all. And I hope we may stay in touch. We certainly will be sharing this, these resources with you. This is recorded. Hopefully that is our way forward for continuing to support one another and learning from one another. Thank you very much.
On behalf of IUSSP, I would like very much to thank our great chair, everybody who was on the panel. It was a really beautiful webinar, and I can assure you this topic is high on the agenda of the IUSSP, and it will definitely remain there. Thank you all very much for a great webinar. Thank you.
Thank you.
Thank you. Thank you, everybody.
Bye-bye.
Thank you. Bye-bye.
Thank you.
Okay. We're still on. I have to find the button where I can turn us off.
Good.
Don't worry.
Thank you,
Great job,
Thank you.
World Pop is really great presentation.
Really great.
Really very good work.
Yeah, everybody did a great job. It was really interesting.
And on time, and it's fabulous. Thank you so much.
Okay, everybody, I'm going to end it now. So
okay,
have a great evening, and thanks to everybody for a wonderful
Thank
webinar.
you.
Bye bye.
Thank you.
Bye.
Thanks again, Alan.
Thank you.
Bye, Nico, everyone.